There. So we are recording the meeting as we usually do. So give it just one more minute. I will note that I have with me here today, in addition to Amy Belisle from Maine DHHS, we have Dina Bushman, who is a new addition to Maine CDC. She's a nurse practitioner and a CDC trained epidemiologist. And actually, I'll let her say hello. We don't have Dr. Sears. He again has absconded off to the wild somewhere, continues to think he's on his path to retirement despite our best efforts. But Dina, do you want to say hello to the group to start?
Sure. Hi, good morning, everyone. My name is Dina Bushman. I'm a nurse practitioner, and medical epidemiologist. I recently relocated to Maine in July, and I'm here working as a medical epidemiologist very closely with Dr. Sears. I'm really excited to be here, and hopefully I can help answer any questions you might have. He's returning from Iceland in a few days. So next call, we can hear more about his adventure.
Great, super, thank you. Okay, hopefully they let him back in, but apparently it's way easier to back into the country than out of it. So I think it won't be a problem. As you all know by now, we've been continuing these sessions on a monthly basis and try to focus on recent updates. So I've just got a brief overview here of the topics that we were going to touch base on, a few of which we mentioned last time. There's nothing new in terms of the actual vaccines. But I did want to mention the news that has come out in the last month about boosters, and then just distinguishing it from the third dose. So this is from the US CDC, and many of these slides I've taken directly from the COCA call on September 28th, but just for our own purposes, to be clear about the terms that we're using. Sorry, I'm just trying to do this. The speaker's not going. Anyway, so third dose or additional dose after the primary vaccine series is when we think that there may be an issue of an immune response. So that's what had come out previously in terms of EUA and FDA, and CDC recommendation, versus the booster dose is really talking about giving an additional dose when the primary vaccine response may have waned over time. We again had spent some time in the last month's session, so I'm not going to go over this in detail, but the third dose is really for both mRNA vaccines for those who are moderately to severely immunocompromised, with a specific list of conditions that US CDC had noted. The third dose should be at least 28 days after the second dose, could be interchangeable if needed between the two mRNA vaccines. But it does not apply to J&J. The new thing, in terms of additional data that's been made available also on that US CDC COCA call recently, they talked about the reactions now that a fair number of people have had third dose of the mRNA vaccines. They noted in VAERS, the vaccine adverse event reporting system, which is voluntary, has its own limitations, but in looking at 22,000, more than 22,000 people, the reactions were very similar to what we saw from the first two doses and from the Pfizer phase 3 clinical trial. And you can see here the top 10 reactions within the first 7 days to Moderna or Pfizer. Very familiar to you all by now: pain at the injection site, fatigue, malaise, headache, and you can see that's anywhere from down at the far end, 10, 20%, upwards of 70% or more for the most common reactions. So nothing really new there. The thing that is new was the booster dose authorization of Pfizer specifically, right? So just Pfizer, big distinction, not Moderna yet on the mRNA side, and not J&J yet, but their recommendation, and I've added the little green should. So their part 1 recommendation is that certain people should get a booster dose, and that is people 65 and older, people living in long-term care settings, and people 50 to 64 with underlying medical conditions, and then they define those as you see here. And as always, we'll post the slides afterwards. The links are live if you want to go back and look at them. So again, that was 65 and older, the adult in long-term care, and then 50 to 64 with underlying medical conditions. And what I won't go over here, but you certainly would be get a lot more info. If you click on that COCA call, you can listen to the whole recording. And there are several presentations about the background, the evidence for the efficacy of that third dose in terms of decreasing particularly hospitalizations and severe infection. The Part 2 recommendation from US CDC, and these have been carried over by Maine CDC in the form of a HAN a few weeks ago. I didn't put the link for that in here, but we could put that in the chat. Feel free in here, Dina, or I can do it once we stop sharing, but it's the same set of recommendations. So the May group are younger folks, so 18 to 49 with underlying medical conditions, and then 18 to 64 who are at higher risk because of occupational or institutional setting. So there, the recommendation is to talk to individuals and assess risk on an individual basis and think about risks and benefits, including those rare risks of younger people, but potentially myocarditis, pericarditis, anaphylaxis if they're potentially at risk, and then the local reactogenicity, side effects, adverse effects after the third dose. The benefits being, again, the decreasing the risk of severe disease associated with hospitalization or death, and potentially the risk, reducing the risk of transmission as well. So again, that's in the May category. You're encouraged to talk about those potential benefits and risks with the individuals. Additional considerations that they suggest are in terms of those occupational and institutional exposures in that May category. Workers, teachers, congregate living settings, including correctional facilities, and we are seeing that in a big way here in Maine with significant outbreaks in several of the county jails right now. And then a person's underlying risk of developing severe COVID. And then it notes that the efficacy of a booster in terms of decreasing risk of future infection is not necessarily yet known. So things to think about in terms of the actual administration. It's the same dose. Timing should be, the recommendation is at least 6 months. I know initially there was discussion of 8 months, but the recommendation is 6 months after completion of the primary series. And just a reminder that it can be given with other vaccines, including flu, on the same day at the same time. The contraindications are the same, and just to everybody to be keeping that in mind as we've got issues of the healthcare worker rule and patients potentially asking for medical exemptions. There really are very few contraindications, and that really are just severe allergic reaction after previous dose of those vaccines. So, and in this case, Pfizer. An immediate allergic reaction to previous vaccine would be something to be watched, and then a precaution, a known polysorbate allergy. Even the presence of a myocarditis after mRNA is not an absolute contraindication, but something that might want to be considered in people making a decision about the vaccine. So really very few absolute contraindications to these vaccines. In terms of what's coming, so that's what's happened. In terms of what's coming, we've got a couple of big things on the horizon. So as you all know, once the manufacturers have completed their studies, then they submit an application to the FDA for emergency use authorization or amendments to their EUA. And so we know that on October 14th, FDA is scheduled to consider Moderna's application for a booster dose. On the next day, the 15th, they will be considering J&J's application for a booster dose, and these are for adults. And then very importantly, on the 26th, as far as I could figure out the date, they'll be considering Pfizer's application for vaccine for younger children, 5 to 11. As you've all seen now, the sequences, after any decisions about those amendments, then go to the Advisory Committee on Immunization Practices for recommendations, and then to the US CDC for final recommendations. And we usually see those within a week or two after the EUA decisions. Just a couple of practical things. Given that now third dose is for just Pfizer and Moderna, boosters are just right now, at least for Pfizer. people have asked the question, what happens if individuals can't remember what they got and can't find their vaccination card? There is this recommendation in the governor's vaccine FAQ with a link where they can request a copy of their record. They obviously, if they can go through their physician's office and look in impact, or they can call a number to at the CDC to get a copy of their record as well. So it might just be a handy thing to have on hand. As always, we encourage providers to consider participating in the immunization program and to participate as a COVID vaccine provider. I am not aware of anything that's changed on that front, so this is not new information. But or Amy, please jump in if there's any changes there that I've missed. One thing on the operational side, the state did announce a week or so ago that they're making the Schedulo platform for vaccine scheduling available to providers who might want to use it. Patients can, once that connection is hooked up, patients then can get directly to that information and can even schedule on the Vaccinate Me website. The info is available in 8 languages in addition to English. And providers have different options for how they can connect with that. You can see here just for walk-in, no scheduling, for scheduling, but not in impact, and then all the way through scheduling and connecting to impact obviously requires variable degrees of integration work on the provider side. And then we've listed some contacts there who could help with that if you're interested in using that platform. Just to remind folks, I think everybody knows there was an emergency rule requiring healthcare workers to get COVID vaccination. Enforcement was delayed to the end of this month, but that is still out there. The emergency rule is in place for 90 days, so goes for a bit longer. And then the proposed final rule has been issued, comment periods closed, and the next steps on that should be coming soon. We cannot comment any further on that final rule because it is in rulemaking process, but any questions about the healthcare worker rule, we refer you to the FAQs on the governor's website, which are quite extensive now. And then just a plug again to be thinking about flu vaccine with COVID. Really need to be on the cautious side about flu potentially rearing its big ugly head this year, even though we had virtually no flu season last year. That absolutely could be different this year. The recommendation is to give it any time from October on, and we know we can see peaks early. I'll ask Dina to jump in just a minute in terms of what we've seen. I'm not aware that we've seen much in Maine yet, but it could be changing anytime. I had presented some of this last time in terms of some of the details, children, pregnant women, etc. Key is you do not have to space the timing. People are very good about remembering that initial recommendation of spacing it out. That is no longer true. You can give it at the same time. You can even give it in the same arm if you need to, but try to separate sites by an inch. These are again slides from the US CDC. You might just want to think about giving it on a different limb, but be careful to record where you've given what in case you're tracking a local reaction, but highly encouraged to consider to have people consider doing that. We are doing these monthly now, so the next one is in November, and always we list other resources in our contact info. So I know that was a lot, but wanted to leave time for questions. So I know people have been putting some of that in chat. I have not been able to monitor.
So one of the more common questions we're getting is around pregnant patients and should they get a booster? So the answer is yes. And ACOG has put on their website that they recommend a booster for those who have gotten Pfizer 6 months after their second dose. So that is a recommendation. And it just seems to be a frequent question that we're getting. I did put the link to the HAN on boosters into the chat. And Jennifer asked, is there opportunity for booster clinics for congregate settings? Ina, do you want to talk about that? I know you put the link in the chat.
Sure. I'm just trying to chat my colleague who works specifically in providing additional resources in congregate settings. So if I don't hear back from her before the end of this call, I can distribute the information she'll share through this listserv. But there is a link that I provided where you can request pop-up clinics at a specific facility or location. So that is an option if you work within a congregate setting, as well as a link to where individuals can get COVID vaccination in Maine.
Do you want to talk about the flu, where you can find the flu information?
Sure. Also in the chat, I provided the link to Maine CDC's flu data and resources. Right now, I'm not seeing that any data are available just yet. Our flu epidemiologist is on leave until the end of this week. I'm guessing when she's back, there'll be more information available. But there was a call just last week with clinicians and public health individuals, kind of started the flu season and public health recommendations. Links to those are available through that website as well.
And Dora, you had put in the chat box that ACIP is scheduled for the 2nd and 3rd of November to discuss the 5 to 11-year-olds. I don't know if you want to say anything more, have any more information on your end.
This is, yes, Dora, thanks. Yeah, I had saw that somewhere. I don't remember where I saw it, but it was a reliable, I think it was a reliable piece of information. So just to give you a timeline, because I know people are eager to figure out when can they start offering the vaccine to that age group or do school-based clinics. So we're thinking
that would make sense from the CDC date, right, of October, whatever I said, 26 or something.
Yeah,
So
the FDA is the 26th.
Yeah, 26, yeah.
FDA.
Yep.
But yeah, and I just also while I put my camera on.
Oh, you have the mic. Go ahead.
Oh, I've got the mic. So other people, we're really having a big issue with pregnant women being willing to get the vaccine. We do have some OB providers who are big champions who are doing a great job getting their patients vaccinated, but we're seeing it the way we're seeing it is our employees are insisting on getting deferrals because they're pregnant, and the OBs are signing off that it's okay for them to have a deferral until after they deliver. So I just didn't know if others are kind of seeing that, number one. And number two, I just wanted to let you all at Maine CDC know that, and we're seeing it across the system, not just in Portland. It seems to be across our service area. So I know I think I've seen a TV ad on that is a focus on pregnant women that Maine CDC is doing. So that's great. So I didn't know if there's other things in the works, the US CDC put out a strong recommendation for them to be vaccinated a few days ago. So I didn't know if that got put out in a health alert as well here in Maine. And I was thinking particularly if it went out to the to the OBs, because they're not all on the HON. So maybe Maine ACOG or somebody could send it out, or other things like that. I just thought to call attention, because it seems like we're seeing hesitancy amongst the women, or I should say pregnant people. I'm not supposed to say women, pregnant people, as well as the OB.
They're not women? Wait a minute, I missed that one.
No, I've been educated, so you can, as a transgender people
Okay, sorry.
can get pregnant. Yeah, I know. We're all learning. I mean, I'm just, I'm learning. So so anyway, so we're having hesitancy amongst pregnant people, the patients, as well as the OB providers. So just thought I'd get that on your radar screen as something potentially that maybe you could help us with.
Yeah, it's a great point, Dora. And I have seen that as well in terms of staff asking for exemptions and being granted medical exemptions from OBGYNs. And it's almost, as much on that end. I feel like we need to be doing some outreach and education to say it's really not an appropriate reason for an exemption. But we could try reaching out. The current head of ACOG in Maine is very collaborative on this and has been very helpful and helped with that ad, actually.
Who's that?
Melissa Collard, is that right, Amy?
Yeah, that's my host.
Yeah. So we could try connecting on that front, because I'm sure you're right that OBGYNs are probably not on the HON and not seeing anything that comes out from here.
And they may just may not know, how serious COVID is. And, US CDC went from a recommendation in mid-August to a strong recommendation a week or two ago. And that's, that is actually pretty significant. And we are seeing, I think at any given time, the last 7 or 8 weeks or so, we've had a pregnant woman, a pregnant woman with COVID in the hospital, and most of the time in the ICU. I mean, the statistics are in the Han, which are very impressive, but we're also just seeing it here in Maine. I don't know what they're seeing in Eastern Maine or other places, but we've been having pretty consistently at least one pregnant woman and very, sometimes very, very, very critically ill with COVID. So
Yeah, good point. Okay. Anyone wants to add on that, Amy, or?
No, I agree with everything you're saying, Dora. I mean, we're starting to get the data from the birth certificate data on COVID and around pregnancy and fetal complications. So I do agree with everything that you're saying. We just got to get the word out to people. There's a couple questions I just want to make sure. So is there any further research on giving someone formerly infected with COVID only one Pfizer as a booster instead of the full series of 2?
I am not aware of any recommendation. Gina?
I have not heard that in terms of a booster dose. It's a one-time dose, to my best of my knowledge.
And I think US CDC has not changed any of their recommendations based on previous COVID infection.
No, they still do endorse the full vaccination series, followed by 6 months later if it's Pfizer, and if you meet the indications for the booster or a third dose in other situations.
Great.
Do we know if the pharmacies that vaccinate long-term care facilities in the winter will be doing the same boosters at the same place for long-term care? The pharmacies are out there doing the long-term care facilities.
I'm less involved in the vaccine efforts in these facilities, congregate and long-term care facilities. It's the same individual who I reached out to, so I can add that additional clarification about long-term care facilities. They're great questions.
And I believe, Dora, from what I've heard, it's variable. I think some have said they're out of it entirely, and some have said they would be willing. So I'm not sure that there's a full plan on that yet. Yeah, I don't think it's going to look exactly like last time.
That's what I understood too. And I just wondered if it was going to be formal, that's like Walgreens is, but Omnicare is not, or whatever. So
yeah, to be clear, Walgreens never did long-term care, but I think it was
or CVS.
CVS, and yeah, anyway, yeah, we can try to track down the specifics, but I've heard at least one of them is not. So and then the flu shot questions, Amy?
About the flu shot, the 65-year-olds are given a higher dose. Is it okay for someone who had a hard time last time with the higher dose to get the regular dose flu shot?
Apologies, I misunderstood the question, so my response doesn't make total sense. I put the link to the appropriate dosing. I guess hard time, I'm not sure I understand. Maybe that refers to like some side effects with the vaccine administration.
So now I'm guessing, if you want to unmute and speak to that, I'm guessing you're right, Dina, that's what that means, that they felt sick afterwards or reported adverse effects.
Yes, she said like she experienced, like she felt like she got the flu. So fever, chills, and like body aches. And so that was something that she was complaining about. And I'm not sure if she got the high dosage the last time, but this is something that one of the nurses said that some people who are over 65, sometimes they're given higher dosages. So that might be the case that she experienced this. So I'm not sure. Is that okay for her to get the regular one?
I think it's a decision that needs to be made in collaboration with her clinical provider. I would say though that the symptoms you've described seem to me to be anticipated or not unusual, that individuals after receiving flu vaccine can sometimes have a day or two of flu-like symptoms, and that she'll probably have greater protection if receiving the appropriate dosing. So I understand that in the short term, there's some discomfort with the symptoms. Sounds like that patient experience, but I would say in the longer term, she's likely to have better protection. That's just me and my own clinical epi judgment, but, I would leave it to the clinician to make that final judgment call.
Though in the end, I mean, it is the person can choose, right? And probably any flu vaccine is better than no flu vaccine. So encourage her to get the higher dose. Say it's not unexpected, but they could still choose, right?
Thank you.
Oh yeah, I didn't know if you had any updates from the field of allergy and immunology, anything that's coming up new as you're seeing all the work happening on boosters.
I think that, I'm sorry, I was just typing a response. I think that most of what we're seeing are successful second and now booster dose administration in people who had reactions to their first dose. Many allergists are working with them to pre-medicate and just being sure that they weren't PEG allergic by testing. There are other options, but giving them an alternative if they're in the precaution or contraindication group. So working with an allergist, even if just in consultation by a primary care physician, may help guide, but we're seeing successful administration even in people who've had severe anaphylaxis to their initial dose. So it's not a contraindication in the sense that you can follow up and work to get somebody successfully immunized.
It's great. All right. Anything else that folks are either seeing or questions? All right, so we're expecting quite a few updates, as you saw, over the next couple of weeks, and God bless the children, and let's get them all vaccinated, hopefully as soon as we can, and really appreciate everybody's help that they might be able to give, whether it's with working with schools or other practices. But yeah, that's gonna be a big next step in addition to all the work around boosters. So thank you, everybody. Thanks for joining. Welcome, Dina. Thanks for joining. And again, we'll be sure to post both the recording and the slides. And as noted, we'll be back again in November, which is Tuesday, November 9th, if I said that right. Great. Okay. Thanks, everyone. Bye-bye.
Take care.